Welcome back. Before I give the floor to Professor Bad, I would like to make some announcements. Tonight, who registered for the Virgo Tour, we will meet at the entrance of St. Paul Street at 4:45. Kindly be on time as we need to make it on time for the ferry. I will leave it in the hands of Professor Shalini Arungori to introduce Professor Bad. Thank you.
Thank you, Monique. Thank you, everyone, for coming back in. Well, the doors will be open, so hopefully everyone can start filing back in from the symposia. But we wanted to kick off so we'd have enough time for you all to listen to Dr. Roshan Bhad's final closing plenary. And it's my absolute pleasure to introduce Roshan for this last plenary of our conference. Dr. Roshan Bhad is currently Associate Professor of Psychiatry at the National Drug Dependence Treatment Centre at AIIMS in India, in New Delhi. He's also board of director ex officio at our ISAM board. He completed his post-graduation in psychiatry MD in year 2012 from AIIMS in New Delhi. And he's also developed an interest in addiction medicine 10 years back during his clinical work in community addiction treatment programs. Roshan is particularly inspired by patients who'd had dramatic improvements after taking opiate agonist treatment. It's a particular passion of his. Roshan received a NIDA ISAM Fellowship Award in 2015, and he qualified as an International Certification in Addiction Medicine in the same year. He was then recognized as a Fellow of ISAM in year 2019. Roshan's particular areas of interest are addictive behaviors in adolescents and youth, community addiction psychiatry, CL psychiatry, drug policy, and public health. Belonging to a developing country, India, he aspires to improve the outreach of addiction medicine training and research globally, particularly in lower and middle income countries. Currently, Roshan's the chairperson of ISAM Next, which I'm sure he'll tell you a bit about. And ISAM Next is a committee of 30 energetic and enthusiastic young addiction medicine professionals from 20 countries. My absolute pleasure to introduce Roshan. I think it's fantastic we have an early career professional to close our conference today. Please join us, Roshan.
Thank you, Shalini, and thank you all for being here. My name is Roshan Bhad, and I am Associate Professor of Psychiatry at National Drug Dependence Treatment Center. Today, I'll be presenting about what is next, role of early career professionals in reshaping the pandemic world. In my presentation, I'll be introducing briefly about my committee, ISAM Next, addiction as a global public health problem, and what is the impact of COVID-19 pandemic on it. And then I'll be coming to the role of early career professionals, how they are playing the role of catalyst in various innovations and changes which is happening after the COVID-19 pandemic. And then I'll be talking something about what is our role in a futuristic way. So ISAM Next is a committee for early career professionals, and it is a committee of ISAM which was established in 1998. You know that it is one of the largest society in the field of addiction medicine, and we have more than 20 affiliated societies and 5 organizations. So why ISAM Next? ISAM is conducting activities for early career professionals for since the beginning. We are conducting various training program, workshops. We are also conducting ISAM examination and ISAM scholarship, which is every year for the early career professionals. Like if you attended dinner 2 days back, so you must have met energetic and enthusiastic young people who got this award. We have also, ISAM has also published about conducting examination and certifying about these young professionals. However, the need was felt to form a separate committee because of the increasing number of people who are taking addiction medicine as a career and a growing interest of them in the field. So that is how ISAM Next was born in 2020. It stands for New Professionals, Exploration, training and education. Currently, we have 30 members, a chair and 2 co-chair, and representation from more than 20 organizations, societies. The purpose of this committee is to increase and improve capability and capacity of addiction medicine training and other educational activities. So in this conference, we have learned addiction is a global public health problem and it is present everywhere. And to address the issue of addiction, we need a multidimensional approach to cover various issues. For example, treatment gap, issue of harm reduction, issue of access to medication and various technologies. So we need a multi-sectoral response. As per the World Drug Report, we know that the problem is there and there's a gross variation across the countries and continent in terms of the prevalence of various addictive disorders as well as substance use disorders. We as the COVID-19 pandemic struck, there was a lot of challenges which was posed in the field of addiction medicine. We managed to conduct a survey and try to find out what was the changes in supply, price, as well as how the countries are adapting and reorganizing treatment services. So we found that individuals with substance use disorder are at risk population and they are vulnerable for this because of this pandemic. We need to have specific strategies for prevention and treatment, and we need to have the need to reinforce addiction care instead of postponing it. So addiction medicine professionals, as addiction medicine professionals, we need to develop various innovations and various strategies to address this problem. That is what we recommended in 2020 when COVID-19 pandemic struck. So how did we respond it, and how is the role of early career professionals is important? So for many of us who are early career professionals, it was an experience of life. That is the first time we saw pandemic. Many of you, but some of you at least heard about the previous pandemic, which was in 1918. That has challenged the training pathway. Many of them were actually going training pathway and mid of their training. There was a limited, there were limited opportunities for jobs, postdoctoral fellowships and scholarship, and because the workforce was moved from psychiatric care or addiction care to the COVID-19 care. There was also limited mentorship opportunities, and there was also issue of work-life balance, family responsibilities. So it had it was a state of ambiguity and vulnerability for this group of young people who was witnessing this pandemic. At the same time, there was a impetus to group together and try to network and solve problems which was posed by this pandemic and try to find solutions. So many innovations were created in this difficult time, and young professional, as they are already exposed to technology and they are well versed with the use of technology, they played important role of catalyst in innovative changes which was brought by this pandemic. So I am coming to now the innovations and response, how this community responded. Now coming to the field of training, as I told you, many of us were undergoing training or mid of their training, and there was a challenge in imparting training or conducting assessment or examination when COVID-19 pandemic was stopped. And because there was a diversion of resources, there was the impact on clinic-based learning. We are used to have the traditional examinations where patients are there, examiners is there, and we're giving the face-to-face examination. So how does Indonesia responded? One of our member, I would like to acknowledge Dr. Angeline. She's from Indonesia, and she is also junior faculty in Indonesia. Indonesia moved to the hybrid system of online assessment, and where the examiners as well as examinee, they adapted to the changes. So may I request you to play video 1? So in this system, what happened that there was a offline option as well as the online option, and let us hear from Angeline what does she has to say
Then
about
you can see here what we did in the clinic. For example, they will supervise the medical student in the clinic. So we will do it using the physical distancing method. So we place them quite far away from one another. Then for written examination, we use our university e-learning management system so that they can learn as well as doing exam using that system. Then lastly, we have modification for examination. As you can see here, usually we did examination every 6 months, and then we'll do it in a hybrid method. What does it mean is one examiner will be there in the room, then the other examiner will be outside the room or via video online uh, application.
So we can see how the team in Indonesia responded to this issue, and they moved to the online system of examination. Now, some of the innovations you may think it's very simple and not technologically advanced, but you have to see the context and you have to see the countries and the problem they are facing. So I'll coming to the next now. So coming to India, we have a lot of patients suffering from substance use disorder. Opioid use disorder is a particular problem. It's a huge public health problem there. There is already treatment gap, which is like more than 90% in a country like India. So COVID-19 pandemic threatened the system which was there in India, and then how we responded. Because there was a serious restriction of movement of patients, they couldn't come to the clinic, and even the doctors or healthcare workers who were managing the clinic, they were asked to take care of the COVID-19 management. As well as there was a various myth and stigma related to substance use disorder, which then again increased the problem. So we launched a telemedication assisted treatment services, and that help us to give uninterrupted care during this difficult time. So in this system, which we developed in-house and in response to COVID-19 pandemic, there is a digital online registration system where patients intake and registration is done. All the data is stored, including the biometric details. And then there is a option to have the physician or psychiatrist can have the virtual consultation with the patients who could be in the clinic in a different room or can be there in remotely. So you can see here the patient having the consultation. We use a simple software which was Google-based Skype, and we are trying to modify and innovate it. Then we also had a methadone bus launch in 2019, where methadone is delivered in the community. And we found that to continue the services and to have the consultation at the methadone bus itself, we integrated TMAT services in the methadone bus, where patient could go take have a consultation and can take medication in community itself. So by this way, we were able to give uninterrupted care and continue treatment during this pandemic. So it had a three component. One was the digital system and clinical workflow automation, where there was a systematic patient registration information available and records available. And using the simple communication hardwares like a headphone and tablet with the basic facility, we were able to deliver the TMAT. So this is another innovation. What we saw that there were some undergraduate medical students in Mumbai, India. They came together, grouped together, and they decided to form a group to help patients with substance use disorders. Because in COVID-19 pandemic, because of the lockdown, many of the alcohol shops were closed, and many people were suffering from withdrawals and other problems, and there was a situation of crisis. So few undergraduate students, they came together, form a project, Mukti, which is also known as freedom in Indian language, and they started an online counseling based behavioral intervention platform with the help of their senior colleagues and senior mentors. They also sensitize the medical students to this problem and train them to deliver intervention. So this is how they did it. They made a flyer, and then there was a option to call this helpline, and Based on the number of call, volunteer was assigned, and after the call was received, patients were directed to the hospitals for the management or given the brief intervention online. And this was done by very young people, less than 25 years. They also, I'll show you, this was the group of people who have done this. So just 25 years, third year of MBBS or undergraduate medical training, and the same group has also presented in our one of the symposium on mentorship. So coming to the innovation in digital technology, the telemedicine was not done only in a clinical setting, but other setting as well. So one of the important setting for treatment use disorder is therapeutic community. My colleagues from Argentina, I would like to acknowledge Dr. Mili Hernandez. She developed a telemedicine application for therapeutic communities, and she developed a system where group therapy, online group therapy could be done in a therapeutic community without being need to do the face-to-face intervention. So this was from Cordoba. So both the prevention treatment services as well as the treatment services was done using this system. So you can see the picture of therapeutic community to one of the largest therapeutic communities in Cordoba, Argentina. And because of development of treatment telemedicine services at therapeutic community, they were able to continue treatment services, because most of these communities also had pressure to vacate the campus to accommodate for COVID-19, similar to in Malta, where there was a pressure to give it for the COVID-19 care. So because of development of this system, they were able to give the care and they were able to continue their services uninterruptedly. So now coming to another country in Africa, Ethiopia, we know that there is a penetration of digital technology, smartphone technology in most of the world, but many countries are not fortunate enough, and some countries do not have penetration of digital technology and smartphone technology available. In Ethiopia, where there is a non-availability of internet services and digital technology, my colleagues, I would like to acknowledge here Dr. Jibril, who is also ISAM Next member. They decided to move on telephone-based consultation and to initiate treatment as well as continue treatment services. In fact, in a first wave, many of the centers in Ethiopia, they were closed and there was nobody there. Patients were discharged. But as COVID-19 pandemic progressed, they decided to go on the telephone consultation, and they were able to give the new consultation for new patient as well as able to continue the continue the consultations. So this telephonic consultation was done for both patients in a OPD basis as well as patients admitted in a different setting, including COVID-19 ward, so that CL setting. So even CL setting also, they managed to continue care using the simple telephonic consultation. And I would say this is a innovation in itself. Coming to innovation in digital technology from Ireland, my younger colleague developed a mobile application which was designed to reduce various harm related to drugs and to enable participants and users to find the harm reduction services and legal services to provide information about drugs with contaminants and adulterants. So I would like to acknowledge here Dr. Florian Shiban. He's from Ireland. He's also a member of NECPAM, which we work together together. So I would like request to play second video, please. So let's see what Dr. Florian has to say about his innovation and about this app, Trip app.
Trip app has a number of features, including a mobile app component and a web map that can be put on any on any website, which allows people to access the service database. That app is available in around 17 languages, going on to 20, depending. Some of them are focused on the web map. Some there's some strings of translations that need to be updated as is a constantly evolving project. That is an area that needs to be developed further. But some of the most of the European languages are represented, and also languages such as Hindi, Urdu, Nepali, Arabic, and Swahili. At the moment, it receives drug alerts through Energy Control's International Drug Checking Services, which receives substances from around the world. That is connected to the TEDI network, but there's no while standards and agreed definitions are being are being decided within that network and what information to be shared. It's still a while away. Hopefully soon there is a possibility of connecting that network should that information become more available. There's also a long-term aim to include other forms of drugs, for example, powders and tabs. There's issues that arise from powders because it's hard to identify a powder over another powder. And then there's access to services. So around 3,500 plus services are mapped. If you have more services that we can map, please let me know. We can connect it into the service system. But current services that we map include opioid substitution therapy, needle syringe programs, sexual health services, drug checking services, drug consumption rooms, gender-based violence services, legal services, and mental health services to be added soon, as our opening hours and direct links to helplines, such as Signal, Telegram, and WhatsApp. And there's also legal information from the EMCDA on the legal status of consumption, supply, etc. For European countries. There's a number of gaps that TripApp addresses. One of them is that evidence suggests that credible evidence of short-term harm in the form of laboratory tests or drug checking can lead to a range of behavior change, such as people not using a certain substance when it's identified to have contaminants or adulterants, or using less when it's considered to be high potency. And a lot of that information is collected and trying to make that information more available to prevent harms. There's also a lack of access to information on drug services, especially when people move between countries and trying to find local services.
Was developed for people who are already using drugs and for providing harm reduction services where the information could be delivered regarding the available services as well as to reduce the harm related to various substance use. So this was coming to the next innovation. We also know that with the increasing in we have increasingly become virtual, and there are a lot of conferences which were happening online. There were CME events, and world was ever closer than ever. But it also created a problem, that there was a problem of language and communication, because countries use their own languages and there is some communication gap. So the need was felt to have some platform to have the real-time translation or interpretation in multilingual conferences and speech-to-text live application. So the communication committee at ISAM, and I would like to acknowledge here Dr. Hussain Modes Ardabali. He's also co-chair of ISAM Next. We are developing a platform where all the many of the languages can be real-time translated into the language of the choice of the listeners, and there would be live speech-to-text captions. And in some of the ISAM events, which is going to be virtual or hybrid, you are going to see these changes in future. So this was also brought by the COVID-19 pandemic. So what were the ISAM Next activities during what ISAM Next was doing? ISAM Next was essentially formed during COVID-19 pandemic. It was launched in 2020. So we were supporting training activities for early career professionals because we recognized very early there is an interruption of training services in various countries. We also decided to conduct a global survey for assessment of training, mentorship, and research needs. We decided to go tie up with the like-minded organizations and networks like NECPAM or WPA ECP, and we also published on the topic relevant to current public health problem. So this was the paper from ISAM Next consortium, where more than 100 respondents, early career professionals from 50 countries, they come together and decided to assess the need of early career professionals. This was about the mentorship program which we launched, and the goal of mentorship program is to establish mentor-mentee relationships with experts in a particular field, paired with new clinician members from Next with wide range of geographic diversity. And we had a symposium on mentorship program yesterday, day before yesterday. So this was the symposium presented by undergraduate medical student and regarding the challenges and opportunities in pursuing career in addiction medicine. These were some of the publications we managed to do during COVID-19 pandemic on public health needs. This was some of the joint webinars we did with NECPAM or like-minded network, and participation in conferences. ISAP conference in Abu Dhabi, ISAM Virtual 2021, present conference. Social media. We understand that social media is a very important tool, and most of early career professionals are using social media, and the trainees are also engaged in educational activities or other activities, social activities on social media. So this tool can be used for the imparting training and the sharing information which is relevant, trustworthy, and authentic. We know we are masters in social media, many of early career professionals, and I would like to acknowledge here Dr. Kaylee Ridley from Australia, who was managing our social media handles during COVID-19 pandemic. Can you play video 3, please? So yeah, so social media is being used effectively by ISAM Next.
On Twitter, you can find us at ISAM Next. It's run by the lovely Erna from Iceland. On Twitter, we can show you what's happening in ISAM Next and other affiliated societies with our members and the latest news in the field of addiction medicine from all around the world. It's also a place to engage in discussion about the topics raised. Lewis et al. In 2018 took a fascinating look at how Twitter as a platform can be part of the solution to the problem of gender inequity in medicine, particularly in leadership positions, and the issue of women being shut out of some academic discourse as a cause of this inequality. The personal peer-to-peer relationships for support, as well as networking and professional development, is a real asset for us as Twitter as a platform. If you prefer the visuals and a bit more of a light-hearted take, you can come over to the Instagram, which is also ISAM Next. This account is run by me, so please hop on there and give me some feedback, comment, like, send me a message. I will also let you know about upcoming events and publications from members, but I'll also feed you some delightful facts from addiction medicine and addiction history. For example, did you know that the Faroe Islands had prohibition from 1907, when 95% of the population voted in favour of banning the production of alcohol stronger than 2%, and this prohibition lasted until 1992, when a referendum overturned the prohibition. And then it's now a couple of craft brewers on the Faroe Islands.
So this is about us, how we are using social media to impart knowledge and attract early career professionals to join various activities of ISAM and addiction medicine related activities. So we can see that there are innovations across the globe, and various countries are doing their bit, and early career professionals are playing important role in getting over this crisis across the globe, right from Australia to Argentina. So what next now? Can we predict the future, or can we foresee the future? Well, the answer could be yes or no, but definitely we can learn from the past. We witnessed a Spanish flu pandemic in 1980, and we had some learning from there. So some of the researchers from Croatia decided to conduct study and find out what happened after the last pandemic and whether this pandemic is going to play the same role. And they tried to collect the data from the available records. And it came out that there was an increase in psychiatric admission and increase in substance use disorder patient admission during last pandemic. And interestingly, for this pandemic also, many of the admission which happened during lockdown and COVID-19 pandemic were actually psychiatric admission or for the substance use disorder in a non-communicable disorder research. So we can see that it is not over yet. There was someone was discussing in the morning about if the COVID-19 pandemic is over. So it is, maybe infections are less, but the impact has been there. Many of our young generation has suffered. They have gone through the difficult time, and we are likely to see some more challenges in the future in terms of increase in various addictive behaviors and substance use disorders. So what we can do? We have a saying in our ancient language Sanskrit, which reads, Chintaniya hi vipadam adavev pratikriya na kup khanan yuktam pradipte vahnina gruhe. That means one must always be prepared for worst situation, and it is too late to show concern and take remedial step after facing a calamity. Just like it is futile to dig a well when house is already on fire. And that was what happened when COVID-19 pandemic struck, because we were not prepared, and because of that we suffer, and we had many challenges managing substance use disorder problem. So what we can do, we can actually prepare for the upcoming challenges, and we can brace for the impact. So COVID-19 pandemic has changed the world, definitely, there's no doubt about that. Addiction medicine and role of faculty, administrators, students, their learning, their administration has changed. Also, the regulatory agencies, various policymakers, healthcare sectors, they have to adapt to some of the changes. Now, we are not sure whether these innovations will continue or will be adopted as a permanent change, or we are going back to the normalcy pre-COVID area. We don't know, but maybe this is the watershed area in the area of addiction medicine, where there's going to be significant addiction medicine pre-COVID era and post-COVID era. So this may be the moment in the history of addiction medicine. And we can see that one of the major changes which is happening is all conferences are being either virtual or hybrid congresses. There are development in the technology and telemedicine. Darknet, we had a plenary a couple of days back. There have been vaccines which have been developed not only for the COVID-19, but also for the addiction and artificial intelligence in addiction medicine. So the best example is this one. This is the first time in history of ISAM, we are having the hybrid congress, where some of our colleagues are online and listening to this lecture. And at the same time, there are some people who are, many of you are attending in person. So this is the innovation, or we can say that this is what going to happen and result of the COVID-19 pandemic. In future, we'll have development in digital technology, which has already been there. There is a lot of research going on digital phenotyping, machine learning, robotics, and at the same time, digital technology also have dark side, where now the drug can be procured easily by using bitcoins on the darknet, and there is a dark side for the telemedicine. There has been rapid boost for the telemedicine. Telemedicine was there before COVID-19 also, but the boost which is given by COVID-19 pandemic is sudden mass adoption. At the same time, we are experiencing issues of privacy, interactiveness, and having the interaction, in-person interaction. So there is a development going on. Telemedicine is going to improve in the future. Vaccines, we all know that we have taken vaccines, but nobody has heard about vaccines and used this word so frequently in our conversation. So many of us have now taken vaccine and booster dose for the COVID-19, and there is a significant increase in spending on the infrastructure on vaccine. For example, in India, we managed to create vaccine within 9 months of pandemic. Not only we supplied to our population, but we also supplied to many of the countries around. So we have now infrastructure for vaccine development, and we already are there. And this infrastructure can be used for the development of vaccine for addiction problem. In fact, some of the researchers are already developing vaccine for fentanyl addiction, where the adjuvant fentanyl vaccine can be given to prevent the overdose. And study has found that it has been found useful to prevent overdose. In artificial intelligence in addiction medicine, we are using it for recognizing crises, using for the virtual group therapy, using for the early sensing technology, and it has come a big way. And one of the best example of artificial intelligence is Pahola, which was developed by Pan-American Health Organization's new digital health. They have developed the new digital health specialist. It is the first digital healthcare worker, and she's programmed with latest information and research. She can help you make healthier, can provide you fact, and she's free to use and interactive, and can easily access from the privacy of your own online app. So this is how she looks. So this is actually the implementation of artificial intelligence for the treatment and delivery of addiction medicine. So where is the role of early career professionals in future? What are the future prospects? So as I told earlier, early career professionals are well versed with the technology. Many of them started using technology very early. They are not only the users, but they are also developers. If you see most of the digital technology which is being developed, apps and IT industry, the young professionals are playing very important role. And so are the young group of patients and our patients. They are also very smart digitally. They are now able to procure substance online by using various methodology. There's no need to go to the drug peddler, but we have darknet and access, and we can have at a doorstep. So, and most of the digital app technology development in various fields are steered by early career professionals. Being at the forefront and witness COVID-19 as a first line of healthcare worker, they also have the edge. At the same time, as a group, this early career professional group has suffered from lack of competency. Their training has suffered. Many of them actually passed when the training was disrupted. So we need a guidance and we need a mentorship from the experienced professional which are available in this hall and from the senior leadership of ISAM who can handhold and take them forward and make our future better. So to conclude my presentation, COVID-19 pandemic posed many challenges in the field of addiction medicine. At the same time, it has created a number of opportunities. We have seen how world is reacting and various innovations have been done across the continent. In post-pandemic world of addiction, we are much likely to see acceptance of digital technology, telemedicine in a big way. It is going to be a part of routine practice. And next generation of professionals, early career professionals, they are playing the role of catalyst in moving this change. We need a support and mentorship to make this transition into new era fruitful and successful. I would like to thank my mentor, Professor Alexander Bhaldachino, President ISAM, Dr. Ravindra Rao from India. I would also like to acknowledge the ISAM Board of Directors for their support for this committee. And all the time, they are most of the time they are available. So we have some of them. Dr. Shalini is here, and Sue is here. ISAM Training and Education Committee, ISAM Policy and Practice Interest Group, Christos is here. ISAM Jain, Dr. Hamid and Dr. Greg is here. And Team ISAM Next, Sophia, co-chair. Hussein, I'm not sure he's here or not, but he's a co-chair. Member Secretary Preeti, she's online. Ex-Member Secretary Panian, she's here. So these are the wonderful group of people who did their activities online. Some of the EC meetings we able to do during the this pandemic. This is the meeting, first hybrid EC meeting we did during ISAM conference. So we have 10 members attending this conference and the rest of the members join online. Thank you so much. This is what I have to say.
Thanks so much, Roshan, for a fantastic presentation. I'm sure you can see the packed room. Everyone's really interested in all that early career professionals have to play in this, and it's a really big overview of all of the activities you've all done over the last couple of years. Just open up to the floor for any thoughts, comments, questions. We've got a couple of minutes to do that. Any questions for Roshan?
Thank you for that excellent presentation, Roshan. And I was wondering, what are your thoughts about interacting with the regional representatives in these areas to connect the regional leadership on a senior level with the new future leadership in Next?
Thank you for your question, Greg. In fact, many of our members are from various regional societies and affiliated group of ISAM, and we need a support from regional leaders and regional leadership to be as a mentor, to get a guidance, and we need their support, and we want to work together and have a solid collaboration with everyone. We are the part of the same ISAM family, and we would like to be there to be involved in activities of ISAM Regional Council as well as ISAM Global Expert Network.
Hi, good afternoon. I'm Paul Seal from Augusta University in Macon, Georgia, USA. I teach in an addiction medicine fellowship, and I just wanted to say I found that your talk was very inspiring, encouraging, and energizing. We've all watched the world battle the COVID pandemic, and so many people were paralyzed and sidelined by what happened. And so it's so exciting to see a group like yours that has really taken that as an opportunity And it's inspiring to us to watch your generation take the special tools that emerging professionals have available to them and try to move us into a new era of treatment. So thank you and congratulations.
Thank you.
Any other questions or comments? And I'm aware there are lots of ISAM Next members in the room as well. So, Joe.
Hi there. Congratulations, Roshan. That was really inspiring. I just wanted to say that I loved the little video clips as well. Really puts a face on what's going on. And I love the fact that a lot of your participants were medical students. I think that's really inspirational. Thank you.
It is just to thank Roshan because it's a tireless work to have this done, and it's an amazing person at a human level and as well as a leadership level. Congratulations to you, Roshan, and thank you for being our chair.
Thank you.
Do we have any other questions for Roshan or any of the ISAM Next members in the room? I might have a question for Roshan while people are thinking. Roshan, I know that you've led a lot of work with ISAM Next over the last 2 to 3 years, really, hasn't it been? So from your perspective, I guess, what's going to be critical for ISAM Next over the next kind of 2 to 3 years? I know we've had lots of collaborations with NECPAM and WHO and other sort of societies. What do you think is going to be critical for us in the next kind of 2 to 3 years, do you think?
I think ISAM Next committee is full of energy. There's a lot of interest. During this conference, many people want to join ISAM Next. They're interested in activities. We have increased our follower on social media, and we're getting a lot of interest. At the same time, because this is a young group, and we need to channelize this energy in the right direction to achieve our goals and to assess our targets. So I think it will be very critical if we get support from senior leadership, senior leaders in addiction medicine in the field, which are there in this hall, who can steer us and who can guide us to take these initiatives ahead.
Thank you. I have a question regarding the adaptations that have been forced on us by the COVID-19 pandemic. Following the challenges that the COVID-19 has brought with it, what should be the modality of multidisciplinary teams, including professionals from the medical, social, and psychology aspect, be moving forward?
I would say that would vary across country and culture, because substance use is a problem which is diverse, and each countries have their own infrastructure, own working teams. So we need to have the solutions which are specific to the problem and regions. So that is the reason that I presented, and there was innovations and telemedicine adaptation. Although it is just a telemedicine, but the adaptation is in various settings and various groups. So you can see telemedicine being delivered at the methadone van or stationary clinic or in the therapeutic community. So we'll have to see what are the system nuances of the system and things, and then we'll have to have the strategy for that.
I've got a question at the back. Marked.
I'm Raju Hajela from Calgary, Canada, founding member of ISAM. It is really exciting to see how far ISAM has come, and thank you specifically to Roshan for the ISAM Next initiative, and also Shalini for all the great work you guys are doing. My question is about building bridges. You've had so much experience now learning from various different countries, and the term addiction even is interpreted differently in different countries. Like even in India, Nasha Mukti Abhiyan that President Modi has started is more nasha is intoxication as opposed to the chronic disease of addiction. And neuroscience tells us that the brain problem is the same regardless of what the substance is or various behaviors, but we still have issues of the S on addiction or substance use disorders. And I'm just wondering what level of discussions or what kind of discussions you've had in your network and where you're heading to build those bridges so that we have some common understanding and terminology. So we treat the broader aspects of the disease of addiction rather than just being focused on one or a few substances.
See, we are the young group of professionals and we're trying to learn from the senior professionals and policymakers. Not many of us are in policymaking or developing group or having the consortium on the definitions or various studies. We did participate in various studies by WHO and also APA studies, but I think that is the issue to be decided by the larger group of experts who are making policy and having the things.
Thanks for that question and that response, Roshan. I think really highlights, I think, the value also that we can all gain from the next generation in terms of shaping the views and thoughts around definition and terminology and language in this space, which is so important. I might open up for one last question because I know we've got our closing ceremony coming up very soon. So one final question for Roshan before we wrap up. In that case, we might leave it there and finish up the final plenary and finish up the conference in a minute. Hand over for the closing ceremony. Thank you. Please join me in thanking Roshan.